My name is Dr. Simon Moore. We are at CFP Distilled right now, and every month we take a look in the CFP journal to find the most clinically relevant articles for you if you're studying for the CCFP exam or if you practice family medicine in Canada. So this month's articles: Budesonide in COVID-19, top articles from 2021, Tympanostomy tubes in kids, plus a bonus article on what to do, what to expect, and what to be aware of if you are a family medicine resident and planning to be pregnant.
Tympanostomy tube placement for kids with acute otitis media. What's the best evidence? What do you do? First, some definitions. So, what is recurrent otitis media? When do you have to refer for treatment? Well, if it's more than 3 in 6 months or 4 in over 6 months, that's when you're thinking about a referral for tubes. But what's the best? What's the final answer? What's the line? Well, it can be accommodation. Tympanostomy tubes decrease incidence, but over 2 years using intermittent antibiotic therapy, watchful waiting, and or tubes, everything's equivalent at 2 years. So consider all of those options when you're treating those cute little kids with acute otitis media.
For your patients with COVID-19, if they've got one or more comorbidity, consider prescribing them budesonide. This inhaler, 800 micrograms twice a day for 14 days, reduces the length of illness by about 3 days, from 15 down to 12 days. It also reduces the chance that your patients are going to need to seek care from 59 down to 53%. The May 2022 CFP Journal has an article on the top articles from 2021. Let's take a look.
What's one of those top 10 pearls for primary care? Low dose ASA for those women who are at increased risk of preeclampsia reduces their risk of preeclampsia. So think about low dose ASA in those patients.
How do you spell success when it comes to heart failure? Well, when it comes to your patients with mildly reduced ejection fraction, we're talking 40% or less, consider giving them an SGLT2 inhibitor. SGLT, I guess, is the answer to how do you spell success. The reason being, there's a number needed to treat of 31, which is pretty solid at reducing cardiovascular outcomes such as hospitalization or death, according to a trial with 6,000 patients.
Delayed antibiotic prescribing for upper respiratory illnesses. The evidence is in, and delayed antibiotic prescribing doesn't result in any negative outcomes and potentially less antibiotic resistance when we're thinking about that big picture of public health.
Turns out that flimsy, floppy, flabby, flat footwear is not a good idea in osteoarthritis. Those patients are going to have a little bit of pain reduction, 1 out of 10 on a scale of 10. But if you give them a supportive shoe, a firm-soled shoe, something with arch support and heel support, their pain reduction goes down on a scale of 1 to 10 by about 2.
Is semaglutide the super drug for obesity? Well, people will have reduced weight while on the medication. However, that's not consistent after they stop the medication. So it does work right now, just in the short term, and you've got to keep on taking the medication. Another one of the top 10 pearls for family medicine.
What's it like being pregnant while you're a family medicine resident? That's the question that these researchers asked in another article in the May 22 CFP Journal. They found there's 3 phases. The first phase, being pregnant at work, has its own set of challenges. The second phase, being a brand new parent at home on leave. And the third phase, they found the most challenging phase, was being back at work, the transition into practice, being off cycle, having difficulty finding spaces in the hospital to pump or breastfeed, and then coming back home and being torn between the challenges of work and a brand new family. So that was a fantastic article in the CFP Journal. Now, we've got a pro tip for you. If there's any chance you'll be breastfeeding or pumping when you write the CCFP exam, make sure you declare this and ask for an accommodation at the time you register for the exam. That's very important. It must be done at the moment you register for the exam. If you show up on exam day looking for a breastfeeding fridge or looking for extra time to pump, you're not going to be given that extra accommodation. So make sure you request it at the time of the exam. That's the CCFP's policy.
Tickets are on sale now for a virtual and in-person option in Toronto in September of this year. So for those of you considering getting an early start in your studying, you can sign up now at our early bird rate.